So we're going to be talking about children's lives during the pandemic and how we plan to collect information, how we've been collecting data, and how we plan to collect information in the future. But what's equally important from our side will be your feedback. We want to hear from you about whether we're missing important areas. As such, there's going to be 2 periods during these talks for question and answer sessions. So next slide, please. We're going to be talking about 3 data collection efforts. The first will be the National Survey of Children's Health, which I'm sure many of you are familiar with. That presentation will be led by Dr. Reem Ghandour, the director of our Division of Epidemiology and the director of the NSCH, and Dr. Jessica Jones, the Assistant Survey Director of the NSCH. That will be followed by our new data collection effort, the longitudinal cohort to the NSCH. And that presentation will be done by me and Dr. Anika Schenck-Fontaine, who's leading the day-to-day operations for the LC. We will then take 10 minutes for questions and feedback on the NSCH and the LC. And then Dr. Olivia Sappenfield will lead the discussion about MCHB's contributions to and data from the census's household pulse survey. And we'll conclude with another 10 to 15 minutes for feedback and questions on any of the 3 data collection efforts. And now I'd like to turn over to Reem and Jess to talk about the NSCH.
Thank you so much, Michael, and thanks to all of you for joining us today. As Michael said, my name is Reem, and I'm going to be sharing the stage with Jess today as we talk a little bit more about the annual survey of the National Survey of Children's Health. So to that end, we'll cover sort of 4 broad areas. We'll provide a brief overview of the survey. I'm quite certain many of you are familiar with it, but it's always good just to make sure we're starting on equal footing. We will talk more about the survey content, both what we currently have and what we expect to come out in the next year. There will be some opportunities for us to highlight how you can get to the data, and then also the timeline of data availability. So this presentation is really just designed to sort of set the stage and make sure you're familiar with the annual survey and what it can offer. Next slide, please. So I suspect many of you have seen this slide before, but it is just a reminder of what the survey looks like if you get it in the mail. The NSCH, or the National Survey of Children's Health, is sponsored by the Health Resources and Services Administration and Maternal and Child Health Bureau and conducted through the U.S. Census Bureau. This is actually a long-standing investment from HRSA, with the first NSCH having been fielded in 2003. So it certainly has grown over time and evolved a great deal, but it is something that we've put a lot of time and effort into for a number of years now, and it informs almost all of our programs. The survey is annual, which for those of you who might be new to the survey, it used to be a quadrennial survey. So by making it annual starting in 2016, we've really advanced our ability to do trend analyses and that kind of thing. It is cross-sectional and it's address-based, and most of the information is collected via web, but we do still have about 20–25% of our responses come in via paper and pencil. Although the survey has evolved over time, the overall sort of core goal has not changed, and that is the survey is designed to collect information on the health and well-being of kids 0 to 17 years, as well as kind of that range of healthcare and family and community level factors that we know influence health. What remains kind of, I would say, a very unique strength of the survey is that we're able to produce both national and state level estimates, and those state level estimates are particularly important when you're talking about policy setting. Finally, we release our data every year on Child Health Day for the previous year. So that's a pretty rapid turnaround. We come out of the field in January and release the data the next October. Next slide, please. This is a very pretty picture of what it looks like when we go out and collect the data. But if you're not too interested in the details of that, I would just highlight kind of two key pieces of information about our survey design. The first is that it is a two-stage questionnaire. So we start with a screener that goes out to households to make sure, one, if there are any kids in the household, and then to roster those kids, get some basic information, age, sex, as well as special healthcare needs survey. Special healthcare needs status. This is then followed by a topical questionnaire that is fielded for one randomly selected child in the household. So that's where we really collect the meat of our information. For a respondent, if you were to be a participant in the NSCH, your process looks a little bit different depending on whether or not you're responding by web or responding by paper. For the approximately 70% of households that get a web invitation or a web push to complete the survey online, it's a very seamless process. You get that letter, you log on, you do the screener, and the Census Centurion system randomly selects one of your children if you have more than one, and then bumps you immediately into the more detailed questionnaire for that kid. If you are completing by paper, you would send back your screener, and then Census would randomly select one of your children if you have more than one, and then send you back the appropriate age-specific topical, which then you would send back again. So it's, again, I think for most respondents, this is a pretty seamless process, and you'll see the results of that in the next slide. So this is, again, to give you kind of a snapshot of just how many cases we do have. We had a really significant sample in 2016 by design, because we've been out of the field for a couple of years. And then subsequently, we've been working with Census, implementing innovations, and really trying to optimize our design and sampling approach. And we've gradually increased each and every year in terms of our sample. What I did want to highlight here is that our weighted response rate hovers just above 40%, but over time, our interview completion rate, so the proportion of families that have kids start the survey and actually finish it, has gone up, and we're at over 80% now. Next slide. So the survey really does have broad utility. I suspect many of you on this webinar are probably familiar with the survey through its special relationship to Title V. And so the survey serves as the data source for 20 of the national performance and outcome measures for the Title V Maternal and Child Health Services Block Grant Program, as well as 15 of our Healthy People objectives for the last 3 decades. We also inform and sort of benchmark for the CDC's investment, specifically around emotional, behavioral, and developmental conditions. And then obviously, as I said previously, we really are anchored to all of the Bureau's programs, specifically those in home visiting, Healthy Start, and the Division of Services for Children with Special Healthcare Needs. Next slide. In addition to our federal partners, the survey has a broad utility for the research community, as well as the private sector and the public sector writ large. So we just pulled a few samples of that, how the survey data have been used over time. One of our favorites was that Starbucks used our 2016 data to change their personnel policies. We knew nothing of this. We found out about it on CNN with everybody else, but we're super excited that they used the data to do that. But more recently, we had Vice President Harris and Yellen urging Congress to really think about the child care proposal that was out there, citing our 2018 and 2019 data, again, kind of focusing on some of these questions that we have related to family burden and child care issues. Next slide. And I think this slide is probably the easiest way to see why the survey has such broad utility, either from a policy standpoint or, sort of a public affairs standpoint. We cover a really wide range of topics, and there are sort of 8 core topic areas that you see here. These range from collecting data on 25 or so different health conditions as diagnosed by a doctor, to access and utilization and quality of healthcare services, to insurance type and status and adequacy, which is really important. And then to that range of sort of family and community level factors that we know can have such a significant impact on kids' health, particularly, we've been hearing a lot about adverse childhood experiences. These are the kinds of questions that are included in the survey. Next slide. So just a word about our 2020 NSCH. So obviously we have these data now. They were in the field from July to January, which is nothing short of a miracle given COVID and all things in 2020. We actually entered the field just 3 weeks late. Huge thanks to Jess Jones for her work for making that happen. And we have just shy of 43,000 completed interviews. This is a year where we're able to really provide some interesting estimates related to preventive healthcare, and we'll be showing you those in a minute, as well as mental health care and some other measures of family hardship. And you can access the data now through 3 different sources. So let's take a peek at some of those estimates that I just referenced. Jess, next slide. So this is an example of what we can do with the 5-year data that we have now. Perhaps not surprisingly at all, there was a really significant drop in the receipt of preventive medical and preventive dental visits among kids in 2020, between 19 and 2020. We really hope that this is a blip and that when we run the data next year, we'll see a nice uptick. But I think it's something that we all need to sort of keep our eye on, especially given that so many kids missed a chance for their regular vaccinations, the anticipatory guidance that is normally received, all of those services that are so important. Next slide. And this is another example of what we can do. These are 3 of the mental health variables that we track. So this is diagnosed anxiety, depression, and then behavior and conduct problems. Unfortunately, what we really saw here was that there was a trend up in all of these conditions, even before COVID. So you hear about everything that we're reading about in the news now and in the research field now about sort of increasing cases of emotional disorders among kids. I mean, this was something that was building, and now we sort of have to worry about what's happened post-COVID. Our data show that both anxiety and depression increased about 28% over that time span, and behavior conduct conditions about 10%. So again, something we really need to keep our eye on. And I'm gonna turn it over now to Jess.
Thank you, Reem. To build off of what Dr. Ghandour was just talking about, we do have data now from sort of early pandemic that was collected in 2020 and is available out in the world, and as the basis for those estimates that you just saw. More is coming. So our 2nd year of pandemic data collection began this summer. The 2021 National Survey of Children's Health launched on schedule this summer, ran with great success through early winter, and we are now working on data cleaning. We're very excited about what this data will mean to the field, both in terms of the new content that was added that I will go through, and also the size of the sample that we were able to collect. So the 2021 National Survey of Children's Health data will be available this October, was our largest sample since the redesign. It will be our largest annual sample to date with over 50,000 child level reports. We were able to achieve this large, robust sample due to an expansion of our partnerships with states to provide state level oversamples, as well as a new partnership with the CDC's Division of Nutrition, Physical Activity, and Obesity, which supported a young child oversample. I'll talk a little bit more about that. Specifically, our partnership with CDC allowed for 5 new questions to be added to the survey to assess nutrition and physical activity, specifically outdoor play among children ages 1 to 5. This was coupled with a national oversample of young children, which will produce a little over 20,000 interviews for that population of children ages 1 to 5, and should support robust state level analyses of both these indicators around early childhood nutrition, as well as the breadth of the content that the national survey collects every year. We are very pleased to announce that this partnership will also be extended into 2022. So this content will be retained for a second year, and the large oversample of young children will also be maintained for a second year. In addition to that new content, we added additional content to assess the impacts of the COVID-19 pandemic on children in 2021 and the 12 months up until data collection. This content was focused on missed preventative care visits, use of telehealth, and interruptions to childcare arrangements. And these questions couple nicely with data that my colleague, Dr. Sappenfield, will present later on that is being collected now in the Pulse survey. Additionally, 2021 marked a year where the NSCH continued to expand its content around discrimination experienced by children. As many of you know, we have long collected questions on adverse childhood experiences to include the experience of discrimination based on race, ethnicity. In 2021, we added a new item, and the data is now currently available on discrimination based on sexual orientation or gender identity. Again, this is parent report of the discrimination their child has experienced. And in 2021, we retained those previous items, of course, but we added an additional question on discrimination based on a health condition or disability. And this new data on this new item will again be available in October. Looking forward even a bit more, as I mentioned before, 2022 National Survey of Children's Health will benefit from a continued partnership with the CDC's Division of Nutrition and Physical Activity and Obesity. We also are pleased to announce that more states will be participating in the ability to produce oversamples. We're up to 10 states. So we expect a very robust sample next year when data collection begins this summer. In addition, we're very excited about new content that we were able to add. Perhaps the flagship for this new content is a series of items on housing instability and insecurity that was led by my colleague, Dr. Lydia LeBrun-Harris, and developed in partnership with HUD. Those 4 items are displayed on your screen now. In addition to this major new contribution around housing insecurity, we have additional new content on academic achievement among school-age children, disordered eating among children, older children, additional new health conditions, including autoimmune diseases, and fetal alcohol syndrome disorder that has been sponsored by our partners at CDC, as well as additional questions on vaping in the home and receipt of supplemental security income, as we know that that particular question is important to families with children with special healthcare needs. That's a taste of things to come in the next 2 years. And perhaps a major achievement that will go into the field at the same time is new content and school readiness, or what we call healthy and ready to learn. So as many of you know, the Bureau has been leading in this area for many years and engaged in a rigorous process of content development and cognitive testing with our partners at Child Trends, the National Center for Health Statistics, and community partners to develop a little over 24 items across 5 domains of school readiness. We're very pleased to announce that this content will be collected this summer in the 2022 National Survey of Children's Health, and that data will be available next fall, specifically Child Health Day, October 2nd, 2023. My colleague, Dr. Ghandour, has led this work and will answer any questions on it later on, but we're all very excited about achieving this milestone despite the barriers of a pandemic. This is our contact information. Again, we're excited to hear your questions later on, but for now, I will turn it back over to Dr. Kogan.
Thanks very much, Justin, Reem. I see, looking at the chat box, there's going to be no shortage of questions about the NSCH. So, and now Anika and I are going to talk about a major new data collection effort, the longitudinal cohort to the NSCH. I'm going to talk about the background, goals, and focus, and then Anika will be covering the rest. And again, here I want to emphasize, we'd love to get your feedback and questions at the end of our presentation. So next, please. Okay. So probably like most of you, no, let's go back one just. Oh, I'm sorry, let's go forward. And so probably like most of you, we were struggling in the first few months of the pandemic as to how we could contribute to understanding the impact on children and their families. And then we realized that we were sitting on a treasured resource that could be used to provide unique data. The NSCH has been collecting national and state representative data annually since 2016, as was mentioned earlier. Therefore, we had a baseline cohort of about 60,000 children whose families had been interviewed right before the pandemic on the overall health and well-being of their child and family. We could recontact those families to find out changes that have occurred throughout the pandemic. And as we thought about it, other longitudinal studies, and we know other longitudinal studies have started, of course, but first they're much smaller, and to our knowledge, none would be state representative, nor would the vast majority have baseline data from before the pandemic began. And so we know that the COVID-19 pandemic has affected nearly every aspect of children's lives. As we talked about, as Reem mentioned, we know we've seen increases in mental health conditions, and even before the pandemic started, and certainly we have seen data from other sources that it's really accelerated during the pandemic. Many of us know about disruptions in childcare and school arrangements. We've seen that too. And as also, as Reem talked about, when you saw the steep decline in preventive visits in 2020, there have been a number of changes in how health services are delivered and their utilization. We also know there's been a decline in the percent of kids getting their routine vaccinations. And so, but yet, again, there's been no nationally or state representative longitudinal study that's been conducted to examine the overall impact of pandemic, particularly with baseline data from before the pandemic. Next, please. And so what we're going to be doing is following up with the 2018-2019 NSCH respondents in support of this study. And so the goals are to assess and provide publicly available data on the longer term effects of the coronavirus pandemic on US children and their families. We're not going to be looking just at key risk factors for this cohort of children. We'll also be looking at who were the children that seemed to do well? What are some of the protective factors in terms of a number of these outcomes? And we, at this time, we do not intend this to be just a one-time follow-up. We intend to continue to follow this cohort through time. Next, please. And so, as I briefly touched upon earlier, the focus is not just going to be on what's going on at this moment, but the focus is going to be on the longer term or lingering effects of the coronavirus pandemic on children's mental, emotional, and behavioral health and learning loss. And we're going to be examining multiple mechanisms as we do with the NSCH. And here are some examples: childcare and school disruptions, disruptions to special services, access to healthcare, social relationships, parental mental health, parenting and family conflict, economic hardship, and the long-term sequelae of COVID-19. And so with that, I'm going to turn over to Anika.
Thank you, Dr. Kogan. Before I start talking a little bit more about content and give you all a better sense of the kind of data you can expect to be able to work with when the LC is released, I want to give a bit of a highlight on the unique strengths of the two studies that we've been talking to you about so far. The NSCH, as you've already heard, does a really beautiful job giving a picture into children's life at one point in time and in one given year. And if we put a number of those data points across the years together, we can look at trends over time. How is children's health and well-being and healthcare utilization changing over time at the national or state level? That, as it relates to the coronavirus pandemic, the COVID-19 pandemic, can tell us a little bit about the kinds of impacts we've seen on kids, and particularly whether trends have changed, whether there's been impact in particular states, for example. We can answer a whole lot of really interesting questions with the new COVID-specific content as well that was added to the survey. Our hope with the longitudinal cohort, I'll be calling it the LC, is to complement this in a way that allows you to use the two studies together to answer different kinds of research questions and different kinds of questions you might have to be able to better do the work you want to do with your populations. The longitudinal cohort is, of course, a longitudinal cohort, meaning that we're collecting information about the same kid over time, which allows us to see changes and transitions that have happened in children's lives. And that information allows us to then answer questions about why did COVID-19 or why did the pandemic affect some children and not others? What are the mechanisms that were at play here? We're able to just dig a whole lot deeper because we're also adding a whole lot more, and I'll get into this, content specific to the pandemic, disruptions that happened, COVID-19 illness information. And so our hope is here that we can give much more deep information about what's going on with children and in children's lives. There's another sort of added bonus of longitudinal data that the cross-sectional data of the NSCH doesn't have. Neither of these studies can really be used to draw any kind of clear causal inferences. But what we can do with a longitudinal cohort, because we have baseline data, is we're at least able to rule out some of those important confounding factors that can give us an even greater degree of confidence in making statements about how we think experiences of disruptions during the pandemic are associated with later outcomes. Next slide. So this is a bit of a teaser slide. I'm not going to go read through this, but I just want to give you a bit of a teaser of the kinds of questions you can think about the LC data being able to answer. So for example, I'll just read the first one. How did pandemic-related childcare disruptions alter expected school readiness trajectories for our young children? Now we have school readiness information from before the pandemic. We know the trajectories we expect these children to take. We will then have information about what kind of experiences did they have with childcare disruptions and alternative care arrangement, and what does their school readiness actually look like in 2023? And having these different data points allows us to answer questions like this. Before I dig further into content, next slide, please, I'll just give a bit of an overview of the data collection plans. Thank you. As Dr. Kogan already mentioned, the sample population will be all children whose caregiver or parent responded to the 2018 and 2019 NSCH surveys. It's about 60,000 children. They were all 0 to 17 in 2018 and 19. I think most of you are probably already familiar with these data. These young people will be between the ages of about 4. We have like maybe 10 3-year-olds. And 22 by the time we follow up with them. The administration will be very similar to what you're used to with NSCH. It's a parent or caregiver report survey, and administration will be done primarily by web, but paper will also be available to folks who don't or can't use web response. Our timeframe is that we are going into the field later in the summer of 2023. This sort of highlights that important point. If we're looking at the longer term or lingering effects of the pandemic, we were not in the field in 2020 or 2021 with this. Our focus is really to see how are kids doing later in the pandemic. And then the data will be available to you all in the fall of 2024. And we are working with the Census Bureau to carry the study out. And they have told us that they anticipate a response rate of about 75%, which is fairly standard for a longitudinal survey. And so that gives us about 45,000 completed surveys. That's enough to have strong nationally representative estimates. And in the case of most groups, also to be able to have state level representative estimates. Next slide, please. So I'm going to take the rest of the time I have today to tell you about the survey content, to give you a sense of how these data might be useful to the work you do. Dr. Kogan already highlighted, we're looking at longer term or lingering effects. And the focus of the NSCH LC is a little bit more narrow than NSCH. We've decided, because of what we already know about the pandemic, to focus in on children's mental, emotional, and behavioral health and any learning loss or learning outcomes that we might see. There will still be items about physical health and certainly about healthcare utilization, but the main focus really we've decided to place on mental, emotional, behavioral health and learning. And there will be two types of content. I'll actually start with the second one on this slide. We're looking at children's sort of context and outcomes in 2023. This will look very familiar to those of you using the NSCH. It's very similar questions. Many of the questions will actually be repeated from the NSCH 2018-29 surveys. The second kind of content is what's new. We've added a very, I'm going to say hefty, because I really think it's quite hefty module that is retrospective data collected about what happened during the pandemic, acknowledging that the pandemic is still going on. So here it says 2020, 2021. Perhaps we were optimistic at the time of writing this. But we're asking about the disruptions, experiences, and concerns that families and their children experienced during the pandemic. And then together, we are going to be able to look at these mechanisms that I spoke about. Next slide, please. So I will highlight some key content areas that are new or revised based on the NSCH. And these are all going into cognitive testing in a matter of a month. We are excited to add a lot of this. Our hope is that most of this will work really well. We're using a lot of validated measures. A lot of the things that we've pulled in are also things that we've seen across other surveys, so that we're going to be able to compare across surveys. However, I'm giving the caveat that these have not been, the survey has not gone through full cognitive testing yet. So we're still at a stage where we're excited about your feedback and thoughts, which is a really wonderful time to be giving this presentation to you. And I'm not going to be talking about content that we're repeating, because a lot of it is something you've already heard about from the NSCH presentation today, or you already have worked with yourself. So this list sort of does the key highlights for new content that's for all ages and across all of our instruments. I'll start with the most obvious, COVID-19 illness. We will be including information about asking about whether a child tested positive for COVID-19, the symptoms, whether they had symptoms, the duration of symptoms, the degree to which those symptoms impacted that child's ability to go through their day, as well as severe health outcomes by measuring hospitalization. So we're asking all of this about the child, but we're also asking this about caregivers, one or both caregivers in the case where there are two caregivers. We're asking about caregiver death, and we're asking about vaccination status, both of the child and any caregiver. So we're trying to get a holistic picture of whether children experienced COVID-19, to what degree COVID-19, the illness, affected the family. We're planning to be able to have data that allow us to measure whether children had long COVID symptoms by measuring the duration. We're working with the ever-changing literature around long COVID to be able to make sure we measure that well. But the hope here is to get a really solid picture of how COVID, the illness, affected a family. We're also going to be looking at how worried the caregiver or the child were about the pandemic and how disruptive the pandemic was to the family's life. Foregone and delayed care should not be surprising, is a very important piece of this for us. We want to know to what degree, of course, healthcare was foregone or delayed more than 3 months, but also what impact did that have on the child's health? Also, what disruptions were there in particular special services, of course, EIPs and special education, but also services around hearing problems or autism, ASD, or ADHD. So we have a range of questions around disruptions to care and delays in care. We've also decided to expand on our mental health and behavior problems measurements. We're using a measure of mental health that is based on measuring the behavior of the child. So we're not only asking about diagnoses, but actual behavior to be able to get a better sense of children's actual mental and emotional health. We're adding some more information around conflict within the families, as well as positive experiences for children within the family. And then we've also, in addition to all of that, expanded our measures of economic and material hardships that families might have experienced. Next slide, please. So I'll just do a few highlights that are specific to different age groups. For our youngest, will be 3 to 5 years old in 2023. So these are the kids that were 0 to 2 when the pandemic started in March 2020. We've developed some new items about childcare disruptions, some of which, at least one of those items comes from the NSCH cross-sectional annual survey, but also added some items about alternative care arrangement and concerns about those. We're adding some new items around developmental screenings. We're using the standard item of whether the screening happened, but also what follow-ups occurred after that screening, and to see was there a dip in this during the pandemic, if that's a particular concern. We'll be including the new Healthy and Ready to Learn measure, of course, so that we can look at school readiness over time. And also, as I already mentioned, disruptions and any difficulty accessing early intervention services for this group will be especially important. Next slide, please. For our 6 to 11-year-olds in 2023, they were 3 to 8 in March 2020. So we'll be including questions about childcare disruptions for this group, but this is where we also introduce a fairly substantial new module on distance learning, school closure, and disruptions to schooling. We'll be asking not only what kind of school closures children experienced, also what mode of teaching for how long, what particular challenges came along with that, and what mental health supports were available to kids through schools during the pandemic. At this age, we're also adding some new social relationship items and to get a sense of how isolated were these children from other youth, and how are their relationships with their peers, and some new learning and school related outcomes. Next slide, please. So these are our adolescents. The instrument here overlaps a great deal with the one for the 6 to 11-year-olds. In this case, we're adding a little bit more information around bullying, especially cyberbullying. And particularly interesting at this age, of course, is the transition to adult healthcare. We are including a number of items that are standard in the NSCH to look at that, with particular interest, of course, for children with special healthcare needs. Next slide, please. And I think this age group is one that we're all very excited about. I mentioned earlier that our youth will be up to 22 years old. This is not the usual population for the NSCH. In this case, we are able to follow up young people that were 15 to 19 years old in March 2020. They'll be 18 to 22 when we're reaching back out to their parents or caregivers in 2023. And here we'll be collecting a lot of the same information I spoke about with adolescents, but we're also going to be asking about distance learning and school closures in higher education. We'll be asking about decisions around higher education, experience with employment or military, how those might have changed because of the pandemic. We're asking questions about independent living, and also how was their transition to adult healthcare, and where are they now when it comes to healthcare? And we worked on a module of items here with some experts in the field with particular interest for young adults with special healthcare needs, and how that transition actually worked for them, especially during the pandemic. And then we're also adding some new disordered eating items here. As a particular focus for the mental and behavioral health. We've decided that that was important, especially in this age group. Next slide, please. So there's a lot of content, as you can see, there's a lot of new content, a lot of additions that are happening for the LC that we're really excited about. Right now, I just mentioned the content will be going into cognitive testing just within a month. Any feedback you have, any thoughts you have are highly, highly welcome. And I already mentioned that data collection will begin in 2023. It'll be late summer. The data will be available in 2024 in the fall, probably close to the time that the NSCH annual data will be released in the fall. I think that's all I have to say for the LC timeline slide. Talked about most of this. Next slide, please. And this is our contact information. I know Dr. Kogan and I are always excited to talk about the LC, so do please reach out, and we're excited to talk about questions at the end as well. Thank you.
Terrific. Thanks so much, Anika. So why don't we, at this point, why don't we take some of your questions about either the NSCH or the LC or both, There are a number of questions in the chats, and I see some of us have been responding, some people have been responding to those. If you'd like to ask a question now, you can just unmute and ask us the question, or you can put it in the chat. Okay, while we are looking for people to unmute, why don't we take some questions about it? So for the NSCH, Reem, Jess, are there questions you have not responded to yet?
So Michael, there was one quick question about the jurisdictional survey. Could you say a few words about where the data are, what's happening, those things?
Sure. We are also doing a survey every couple years in the 8 US jurisdictions. It is supposed to be a cousin to the National Survey of Children's Health. That's because when we redesigned the National Survey of Children's Health, it was meant to provide data on a number of the Title V performance measures and outcome measures, but the jurisdictions didn't have that opportunity when we designed the NSCH. So we started the jurisdictional survey a few years ago. We have completed one round of data collection for all 8 jurisdictions. We are now in the middle of the second round. We will be publishing a data brief on the results from the first round in the next 6 months or so. And so it is not included in the longitudinal cohort because one has to have been in the NSCH to be eligible for the longitudinal cohort.
Jess, I responded to a bunch of these, but would you like to speak to the difference between weighted response rate and interview completion rate?
Sure, I would be happy to. So the weighted response rate is sort of the initial and high bar. What proportion of folks responded to our survey? What proportions of contacted households responded to our survey? So that would include non-response by households that didn't have children. That would unfortunately include when there's some error in the Census Bureau's records and we send an invitation to a household that is actually a business. And if we don't catch that, they get counted as non-response. So it's harder to achieve a very, very high response rate when several things can go wrong. Though that said, we are extremely proud of our 40% and above response rate on the national survey. It's comparable or exceeding many of our peers. But that is sort of a first initial step of who responded that was invited to respond. The interview completion rate is a bit more of a measure of how well our instrument is doing in keeping the respondent engaged. So once we've identified that, yes, the household has children and yes, they are eligible for the National Survey of Children's Health, 80% of them go on to finish the survey, answer all of the questions. And we've seen that number go up over time because we've been able to make improvements in the user experience just to keep the folks that we need most engaged and participating in the data collection activity. I saw a question on the LC, Anika, that I think you would be able to speak to. That was in two, actually, that was in the chat. One from Carol was on whether or not our items on COVID-specific hospitalization assess hospitalizations with COVID or hospitalizations because of or for COVID.
That's a very good question, since that's something I know all of us are looking at current data to be telling us about pediatric hospitalizations. Our question is whether the child or the caregiver was hospitalized because of COVID or COVID-related complications. So these will be COVID-specific hospitalizations. These will not be children who were hospitalized for a broken leg and happened to test positive for COVID-19.
We were also asked what our measures of economic hardship would be for the LC.
I can talk about this for hours. We have measures of the primary domains of economic hardship, where we have a measure of basic hardship, being able to make ends meet, housing hardship, homelessness. We will be asking about food insecurity, and we're asking a number of different things about food insecurity, and as well as job loss and insecurity in employment as well. Those are our various economic and material hardship measures. I can share more detail in the chat if it's preferred. So please, if you have detailed questions, I'm happy to answer them in the chat. But that hopefully is an overview.
Okay. And then Diana Liu asked about a question about the LC. For those who are over 18, are you planning to ask now young adults 18 to 22 to respond in addition to the parents? I mean, we know that a significant portion of young adults that age are still living at home. The survey will still be sent to the home, and it will be, I believe, addressed to the parents, but they can also have the option to have the young adult fill it out. I'm pretty sure, I'm not 100% sure on that. That's a good question. Anika, do you understand that differently?
No, so my understanding is that the parent or caregiver will be the one responding. The youth may be supportive of that, but as I understand right now, we cannot contact the youth. So
yeah, I mean, my understanding is, well, the reality is they'll probably ask the young adult, hey, how, what do you say about this? But yes, it will still be through the parent. Then we have a question also, I believe, for the LC. Do you have questions around ER use for behavioral health emergencies during the pandemic? It's an interesting question.
it is an interesting question. We will not have a specific measure for this, but that is something we can think about. We know we will have information about behavioral health problems, and we will have information about ER usage. We do not have an item right now that connects these two. That's certainly something we should think about.
Yeah, thank you, Rachel. That's a very interesting question, and we will consider that. Manjala, if I'm pronouncing that right, why is the transition to adult healthcare start as early as 12 years old? The response is that goes on recommendations from American Academy of Pediatrics. And it goes, we're just following recommendations at that stage. So Manjala also asked, will the medical home components also be reassessed? Anika, would you like to take that?
Yes, several of the elements of the medical home official measure will be reassessed both during the pandemic and at the time of the survey in 2023. So we will have 3 time points of which we know about several of the elements of the medical home measure.
Yes. Then Richard made a comment, the NSCH is a rich source of information to influence systems change at all levels of the public health ecological model for all states, especially jurisdictions. Thank you. We will be sending you the check for $50 soon for the compliment. Marina then asked, is the LC cohort data available for individual states as well? Yes, that is our intention. This will be state representative as well. And then Elaine provided us information on Massachusetts Department of Public Health, conducted the COVID community impact survey in the summer of 2020. She talked about the findings, the number of 35,000 total respondents, and gave some of the results. And she was kind enough to put a link into the survey. So thank you so much.
Dr. Kogan, this is Rachel Stanley from before. I'm actually one of the PIs of PCARN, which is an emergency medicine pediatric network funded by MCHB.
Yes.
And we collected data during COVID on visits And the reason why I talk about behavioral health emergencies is we saw almost a doubling of the number of children coming to our EDs during the COVID pandemic and continuing with behavioral health emergencies. Whereas everything else pretty much dropped off. Our volumes dropped by to 20 or 30% of what they normally were, but behavioral health visits increased significantly. That was just some context for my question.
Okay. No, thank you. That's really helpful information, Dr. Stanley, and we will definitely be talking about whether to add that to the LC. And then Anjan, Dr. Singh, for the LC, do you have any questions around recreational screen time behaviors and usage? Anika, would you like to take that one?
Happily. We have questions both about leisure screen time and school-related screen time. So we've divided them out for school-age youth so that we can identify the duration. And we are looking at new categories for duration to look at longer time periods. Our standard NSCH categories only go up to 4 hours or more. So we're trying to get a little more granularity in the actual amount of screen time. But yes, we will have items for this for our up to our adolescents. And then for our young adults, because we did not think that this is a feasible question to ask a parent or caregiver of a 21-year-old, we instead have decided to ask questions about whether the parent or caregiver is concerned about whether that screen time usage of that young adult is impacting their ability to work or live a healthy and functional life.
Okay, Amy Sullivan asked, has there been an assessment of the impact of housing instability on the NSCH sample? Jess, Anika, you work most closely with the census. Do you know if that's been done or it's intended?
I'm sorry, so is it non-response concerns based on housing instability? Was that the question?
Yes. Well, it's an assessment of the way they phrased it, an assessment of the impact of housing instability on the NSCH sample.
So no, to my knowledge, there hasn't been an assessment to see if that is impacting our sample year to year. The National Survey of Children's Health is not representative of unhoused children. We did take great pains in the redesign, though, to word the questionnaire in such a way that we would capture kids who were staying at an address as opposed to just kids who consider that to be their home in order to get at some level of housing instability, doubling up, things of that nature. Reem, is there anything else you might want to add to that?
No, I had responded in the chat. I really, other than the response bias analysis, there isn't anything that we've done specifically on that topic.
Okay. Then Nicholas asks, will the LC assess or reassess whether children have certain behavioral developmental conditions? This would be interesting to understand incidents around this cohort. Absolutely. That's going to be one of the major foci of this study. So thank you for asking that. Stephanie asked about food insecurity or food insufficiency for the LC.
Yes, and I had clarified in the chat, it's actually food insufficiency, and thank you.
Okay, great, thank you. I'm just curious. Diana made the comment, I'm just curious whether parents and the young adults would respond different or have different answers. That would be interesting to look at. Unfortunately, we wouldn't be able to do that with this survey because, as Anika mentioned, we're only getting it officially through the parents. And so we have 11 more comments in the chat, so please keep them coming. But now I want to leave sufficient time for us to talk about the household pulse survey. So with that, I'm going to turn over to Dr. Olivia Sappenfield.
Hello, everyone. Good afternoon, good morning, if we can still call it such. I'll be presenting on the Household Pulse Survey and our sponsored content within it, which reflects current federal survey efforts to assess the impact of the COVID-19 pandemic on children and families. And here's a quick agenda that follows the previous presentations formatting. Next slide. So the Household Pulse Survey the purpose of it is to assess the social and economic impacts of the COVID-19 pandemic on US households. It is administered by the US Census Bureau in partnership with the Maternal and Child Health Bureau and other federal partners. In addition to assessing the social and economic impacts, the data can be used to inform federal and state response and recovery planning. And here, the Maternal and Child Health Bureau focuses specifically on households with children. So the Household Pulse Survey is an experimental data collection, also known as a pulse survey, and it is a web-based survey format so that we can collect information in near real-time data. The Household Pulse Survey went into the field in April of 2020, and our sponsored content came onto the survey in phase 3.1, which is April of last year. We just wrapped up phase 3.3 last week, and we'll be getting 3.4 next week with our content still ongoing. Next slide. So as far as who is included in the Household Pulse Survey, so during each survey period, which is roughly 2 weeks, over 1 million households are randomly selected from the Census Bureau's master address file. And one adult within the household is selected to respond via text or email. And approximately 57 to 78,000 adults respond with each survey wave. And about a third of those respondents represent households with children. So that means that they reside in a household with at least one child. I will note here that sociodemographics are collected on the adult respondents, but not of any children in the household, which is a limitation I'll talk about later, but thought you would want to know that here. So once data are collected, they are then weighted for non-response to match the adult US population by age, sex, race, Hispanic ethnicity, and education. And this is reflected in 80 replicate weights, both at the person level or the adult level and the household level. So the data are collected roughly every 2 weeks and released every 2 weeks up through phase 3.2. But then beginning in phase 3.3 onwards, data are collected roughly over a 2 week period, but released every 4 weeks. So with the Pulse survey, I will highlight here that the sponsored content that we included were the use of children's preventive visit attendance, children's use of telehealth, childcare disruptions experienced by the household, and the economic, or really the employment impacts of that disrupted childcare. Next slide, please. So just as a quick snapshot, here are the indicators that we included in the phases of the survey. And the text in red in phases 3.2 and 3.3 were changes that were made. Key highlights are children's telehealth item did not change across the phases, but an additional item was added. With children's preventive visits, we went from whether any children delayed, missed, or skipped visits to determining whether all summer, none of the children in the household attended a checkup. And then with childcare, we went from asking about closed or unavailable childcare specifically because of COVID to whether childcare was closed or unavailable for any reason during the pandemic. Next slide, please. So moving on, I would like to present just a snapshot of some of our sponsored content across the phases that you can do yourself or read in recent publications. And beginning with phase 3.1, which started in April of last year. This is a snapshot of data from a publication by Dr. Lydia LeBron Harris, Dr. Michael Warren, and myself. And what we found in April to May of last year is that roughly 26% of US households with children had at least one child who missed, delayed, or skipped a preventive visit. And that was similar to, I think, what the annual NSCH had that you saw earlier in the presentation. And 19 states in the US had a proportion of missed, delayed, or skipped preventive visits that was higher than the US average. There was one state, Wisconsin, which I know looks pink, I promise it's not pink, it's striped, that had the same proportion as the US. Next slide, please. So digging deeper into this data, we found that delayed missed skip preventive visits was strongly associated with some measures of material hardship. And we found that in US households with children that experienced material hardship on being behind in rent or mortgage, or sorry, I'm having trouble reading the slides with the comments popping up. Difficulty paying usual household expenses, and then food insufficiency on part of children, meaning that children could not eat enough because of lack of affordability, had a much higher proportion of households that missed, delayed, or had a higher proportion of households with at least one child who missed, skipped, or delayed a preventive visit. Next slide, please. So children's telehealth, as I briefly mentioned before, had the same item across all phases from April of last year till now. And what we found was that the proportion of US households with children who use telehealth has decreased from April, May of last year to January, February of this year. And with the dashed lines are just breaks when data were not collected. However, we did find that when we dug deeper into this data, that the trend in telehealth use did vary across some subpopulations. Next slide, please. For example, in the most recent waves of data, we found that the percent of US households with children reporting telehealth visits differed by race, Hispanic ethnicity, and health insurance. We saw that the proportion of telehealth use was higher among households with children, indicating a Black non-Hispanic or Hispanic household, and adults on public insurance, but was lower among Asian non-Hispanic respondents and white non-Hispanic respondents in US households with children. And we did see that this pattern of results happened across earlier waves of data as well. Next slide, please. And for our third and final indicator, we were able to collect trends in childcare disruptions from July, August of last year till recently. And again, this is on whether or not childcare was closed or unavailable for any reason during the pandemic and not COVID specific. And we found that the prevalence of disrupted childcare was consistently higher among adults in US households with children living at or below 200% of the federal poverty level. And if we broke this apart by more granular level of poverty, we found a stronger effect in even lower income households. Next slide, please. And this really showed up in important ways when we looked at the employment impacts of what disrupted childcare did to US households with children in a childcare arrangement. And we found that US households with children living at or below 200% of the federal poverty were more likely to take unpaid leave or leave their job as a result of the disrupted childcare in the most recent waves of data. Whereas with households living above 200% of the federal poverty level, we see that adults were more likely to cut hours, use paid leave, or supervise a child while working. And similar to early results, these patterns did persist in earlier waves of data, only they seemed much stronger in the most recent waves of data. Next slide, please. So I know that was like a very quick snapshot, and I'm happy to go over any more of the results or questions that you have. But I did want to take a moment to just highlight some of the other topics relevant to children's health that you could look into. Again, like in households with children as opposed to children specifically. And they include children's vaccine status, vaccine hesitancy. You go and dig deeper into children's food security. I think there are a couple more items. We've seen publications using the child tax credit and just like a few other research topics. Next slide, please. So as mentioned before, there are a few limitations of using the household pulse survey, and these are just 5 of the ones that we found most relevant to our research. The first one, which I shared, is that the adult respondent may not be the parent or caregiver of the child in the household. They just reside in a household with at least one child. So this could be someone who's not familiar with the child's healthcare use. They may not be the parent or caregiver. Also, the characteristics of the respondent may not be reflective of the child. And unfortunately, children's sociodemographics were not collected. However, in terms of looking at households with children, some of these patterns and the effects that might go into them do seem representative of the children living in those households. Additionally, the pulse survey was rapidly implemented and relied on online response, which could increase susceptibility to non-sampling error. We were particularly worried about differential access to the internet. However, response rates were within acceptable ranges for other pulse survey designs, which was reassuring. And additionally, we did see some different response patterns by demographics. However, a lot of the weighting estimates should mitigate some of the selection and non-response biases. Next slide, please. So like I said, that we have put out some of our sponsored content so that others can see what happens. However, the household pulse survey is open for public use, and a few others have taken the time to dig deeper into the data. As of summer, fall last year, we saw a couple of individuals publish on our childcare indicator. Additionally, the Kaiser Family Foundation put out a report addressing back to school amidst the COVID-19 pandemic, which included our indicators, I believe, on telehealth use and preventive care or preventive visits. And I think you might see more, but I unfortunately have not updated this slide recently. Next slide, please. So thank you again. I know this was a really rapid walkthrough of a rapidly implemented survey, but I am happy to answer more questions that you all might have, including ones that might be in the chat.
That's great. Thank you so much, Dr. Sappenfield. And would you like to talk about that the household pulse survey is very different than ours, and how different agencies might take questions and either take them off or put them on when they've seen trends not changing. So there's the opportunity for new content. Would you like to take a second to talk about that?
Sure, I will. I'm happy to try to address that question. And if I miss anything, hopefully Dr. Ghandour could back me up and answer some of those questions. As part of the rapid implementation for the survey, it goes through in phases, and part of that is to take essentially the pulse of the country and maybe states or other agencies to identify what is most relevant that is happening in the pandemic right now. And so we've been fortunate that many have felt that our sponsored content on preventive visits, telehealth care use, and childcare have continued to be important throughout the pandemic. But in the month or two prior to the implementation of a new phase, any agencies partnering with the US Census Bureau can put forward to have content included on the pulse survey. And so there is occasionally a switching in and out of content that might be important, which is why some indicators might not happen across all phases, or some might happen up to a point. And so I think currently right now we are looking at potential changes to phase 3.5, which I believe will go into the field at the end of May, is roughly what I remember. And so again, like that's just to help us be sure that like we're looking at the key social and economic impacts that are of particular importance in a near real-time situation, as well as what federal and state partners might need in terms of like planning going forward with pandemic effects.
Great, terrific. And now I see it looks like more questions have appeared in the chat, and people can please feel free to continue to ask us questions. I haven't been keeping up with the chat as I was focusing more on Olivia's presentation, but are there questions? I saw Anika was responding to some, Reem to others. Are there questions we haven't addressed yet?
Can I add one comment on the selection of content on the pulse? Just because I think it might be relevant for folks. I think, Olivia, everything you said was spot on. The only other thing that I have to remind myself when we're thinking about content for the pulse survey is that you're really looking at relatively short response frames. So you're not really trying to get a snapshot of the entire experience of the pandemic, or but it is most useful if you're looking at indicators that you expect are going to bounce up and down, you know, every 4 weeks or even every 2 weeks. So for example, if you really want to be tracking vaccinations, or you want to be tracking measures that we are putting a lot of energy as a nation into changing behavior or access, those are the kinds of things that can be very useful to track via pulse, because again, it's a fairly rapid, the cycles are pretty rapid and they're in the field every 2 weeks.
Great, thanks. Thanks, Reem. I see Nicholas asked if the longitudinal cohort will continue to collect information over time. That is our intention. And will there be opportunities to sponsor content? Yes, I imagine there will be. I imagine we will follow the same model that we do for the National Survey of Children's Health, which has been co-sponsored for certain questions by other agencies. And I'm going through the list now. Does anybody see anything else we haven't addressed yet?
I think Carol's comment could be applied to all surveys here. Has participation been affected by citizens' lack of confidence in the government? And do we ever receive comments along these lines?
Yeah, Carol, that's a terrific question. And we have seen response rates for almost every government survey go down, as probably many of us know. On the other hand, the response rate for the NSCH has stayed fairly constant and has been the salmon swimming upriver. And then secondly, even better news is that the interview completion rate has gone up every year. It was around 69% when we first started this round of the iteration of the NSCH in 2016. It's gone up every year. Now it's around 80%. So that what that means is once we locate people and they're eligible for a survey, a higher and higher percent of people are now participating in the survey. And I can't explain it other than to say that they probably think that the staff on the NSCH are wonderful and somehow know that and want to participate. So if there are, unless we miss something in the chat, if people want to ask a question, or I think we've tried to address everything in the chat. And this is not your last opportunity. If you have ideas, please just send them to us. And all our email addresses are in the slides. And so we'd love to hear from you. So unless there's something that anybody on the staff wants to add.
Yeah, again, thank you everyone for joining us. Thank you again to our speakers for such an informative presentation. Like I said before, I will be sending out a recording, and there will also be an evaluation survey attached to it. So if you guys want to take the time to answer that, that would be terrific for us. But yeah, no one else has any other questions. Thank you so much again.
Yeah, and I'd like to thank everyone for taking the time and for your interest and your questions. We really appreciate all your feedback and your thoughts on this. And of course, I'd like to thank our staff and thank CityMatch for sponsoring this and all your support. So thank you, everybody.